Go ahead.
So, Assalamu alaikum wa rahmatullahi wa barakatuh. It's my great pleasure to welcome you a presentation made by Nagamia Institute of Islamic Medicine and Sciences. So my name is Layali Bayrat. I am trying to pursue my doctorate of pharmacy degree. Soon will be graduating from the University of Illinois in Chicago. I am just astonished by everything NIMS does. It's a nonprofit, a group of Muslim researchers and physicians that contributes so much to patient advancement through their studies. I actually have done health fairs with the program, and I'm just really blown by all they have to offer. And so, and a special thanks to Ms. Alia and Dr. Nagamia and Dr. Mubin Syed for just all their contributions to the organization as well, and who I have a pleasure of meeting too as well. So we actually have a recording made by Furqan School to showcase ayat from the Quran that kind of correlate to our presentation today. So it's Surah Fatir 35 and the ayat 28 to 30 will be showcased right now.
أعوذ بالله من الشيطان الرجيم ومن الناس والدواب والأنعام مختلف ألوانه كذلك إنما يخشى الله من عباده العلماء إن الله عزيز غفور إن الذين يتلون كتاب الله وأقاموا الصلاة وأنفقوا مما رزقناهم سرا وعلانية يرجون تجارة لن تبور ليوفيهم أجورهم ويزيدهم من فضله إنه غفور شكور صدق الله العظيم.
Okay, and now I will be following up with English translation. So just as people, living beings, and cattle are of various colors as well, of all of God's servants, only the knowledgeable of his might are truly in awe of him. God is indeed almighty, all forgiving. Surely those who recite the book of God, establish prayer, and donate from what we have provided for them, secretly and openly, can hope for an exchange that will never fail, so that he will reward them in full and increase them out of his grace. He is truly all forgiving, most appreciative. So I want to give a special thanks to Furqan School and for Rayyan Syed's amazing recitation to us all. Now moving on with the program, I'd like to introduce Dr. Mubin Syed. With our current day and age of Islamophobia, really showcasing contributions of Muslims, I believe is really crucial. And the discovery presentation that I'm talking about today really showcases just amazing contributions that Muslims offered for patient advancement. Dr. Syed is an interventional radiologist and neurologist who received his radiology residency training at Indiana University Medical Center in Indianapolis, followed by interventional radiology and neurology there as well. He is board certified in those disciplines, as well as interventional pain, vascular medicine, and obesity medicine. Currently, he is a clinical associate professor of the Radiological Sciences at Wright State University Boonshoft School of Medicine and president of Dayton Interventional Radiology. Dr. Sayed was recognized as a Fellow of the American College of Radiology and Fellow of the Society of Interventional Radiology for his teaching and research contributions to the respective fields. He has published a book, multiple book chapters, and numerous peer-reviewed journal articles with over 500 citations. He is also a holder of 15 granted patents for medical devices. So without further ado, Dr. Mubin Sayed with Modern Muslim Heroes of Medicine. Dr. Sayed, the floor is all yours.
Thank you, Laili. It's really a pleasure to be here. I'm just going to open up my presentation. Okay, can everyone see it, I hope?
Yes.
Okay, great. Well, assalamu alaikum. Thank you for the introduction, Laili. It's really an honor to be asked to speak for NEAMS. Really appreciate the invitation. Today, I wanted to talk about the topic of modern Muslim heroes of medicine, the unknown and invisible giants. This is actually an area that's been of great interest to me. I, of course, have always found it very fascinating to learn about the great Muslim scientists and physicians from the golden age of Islam about 1,000 years ago. What these scientists and physicians did is really fundamental to medicine and science as we know it today. They're the forefathers of basically what we have today. They didn't just pass on the torch, but from between the Greeks to modern times, but they were actually innovative physicians themselves. They created a lot of fields of science and medicine that we take for granted right now. Medicine is actually, it's really the basis of modern medicine comes from what was discovered and invented in the golden age of Islamic medicine. I think it's great the work that Dr. Nagamia has done. But one of the things that really has been of concern to me and sort of disappointing is that we really don't know any Muslims in the current age who've done anything of note or of any significance. Most people, including myself, really, did not know of any contributions that Muslims have been making in this day and age in medicine and science. And I used to think, well, is this really, really true? There's really no Muslims that we typically hear about in the different ways that they're recognized, different awards or, prizes that awarded in, different fields. And, I always pondered about this, even though, certainly 1,000 years ago, for instance, I know for a fact that every single one of the Nobel Prizes would have been, awarded to Muslims. There's no doubt about it. Every year in every field, I think it would be no contest, really. And nowadays, it's really not very common at all to hear any Muslim names of any great physicians or scientists in modern times. And, so starting this quest, I really started out with Google. I just started doing a search in Google for, modern great Muslim physicians or contemporary or current Muslim physicians, just to look for their contributions. And of course, all I would get would be, again, the same physicians from 1,000 years ago from the Islamic Golden Age. That's what would show up whenever you did a search for great Muslim physicians. And I pretty much accepted this as a tragedy. That there's been no contributions in modern times. And so I really thought to myself, can this really be true? I just couldn't believe out of a population of 2 billion people that there was hardly anyone of fame that had achieved anything. And so what I did is I kind of went through the history of numerous fields of medicine, and I just, looked up the history of each of these fields from article to article. And sure enough, as you do this, you start coming across Muslim names. And this was actually very interesting to me because, they're not necessarily publicly known as Muslims, but if you actually read their stories, I mean, there's articles written about them. If you even correspond with these physicians, you'll realize that they actually are Muslim. It's clear that they're Muslims. And so it's really gratifying for me to have found these these unknown giants, these invisible giants. And that's why my presentation is called The Invisible and Unknown Giants, the Modern Muslim Heroes of Medicine, because these really are truly modern Muslim heroes of medicine. So let me get started, and we'll go with the first slide. It's interesting that many of these names that I'm going to be talking about are actually honored by mainstream medical organizations. In fact, by people of other faiths have been recognizing these physicians now for a long time. Unfortunately, they're somewhat unrecognized by Muslim physicians and the Muslim world. They're actually known as giants by their contemporaries, yet specialists who happen to be Muslim don't know that these guys actually did, what they created in these specialist fields is something that's basically taken for granted. So many of these physicians have made, this is the one thing that actually fascinated me as well, that many of these physicians, scientists, and inventors have actually made more profound contributions to medicine than some of the ancient physicians of the Islamic Golden Age that are really lauded by everyone, whose names we're all familiar with. So today the purpose of this talk is to honor these unsung heroes and their contributions to the field of medicine in general. So let me start out with cardiology. In cardiology, there's two major concepts in modern times. One is called hibernating myocardium. The other is called prosthesis-patient mismatch. Hibernating myocardium is actually something that could make the difference between life and death. It actually affects 50% of patients with heart disease. And basically what's happening is that when there's not enough blood flow to the heart, instead of the muscle of the heart actually dying, it actually goes into what's called hibernation to protect itself. And in reality, what you can do is it actually acts like it's not, it's dead. You would think because it's not moving right, or it's really not contracting like it should. People used to think that heart muscle was actually not alive. But in reality, what this doctor theorized was that if you could improve the blood flow, that hibernating heart muscle could actually start working again and actually can save the life of that person. So this was a major concept, hibernating myocardium. The other concept was prosthesis-patient mismatch. Inside the heart, there are actually what are called valves. These structures make sure that the blood flow through the heart goes in the proper direction. It goes in one direction, in the direction that it needs to go. So we naturally have these valves, these structures that are designed to keep the blood from going backwards, to always make sure it goes in the right direction when the heart beats or pumps blood. It turns out that, with modern surgical techniques, sometimes when patients need this, when their valves are not working properly, they can have surgery to have the valve replaced. And the unfortunate thing is that in 2 to 11% of patients, there's actually a mismatch. Typically, the heart valve is too small for the patient's needs. And it's actually moderate in severity in 20 to 70% of the time. So it's a huge number of patients that are actually affected by this. And this doctor actually figured this out, and he came up with this finding. And his name is actually Dr. Shahabuddin Rahimtullah. He's a cardiologist. He just recently passed away, but he is actually honored as cardiologist of the world. The terms about him that I've come across are father of research, contemporary giant of the Mayo Clinic. He's actually Mayo Clinic's, which everyone knows is one of the top medical institutions in the world. He was one of the top 50 all-time practitioners of the Mayo Clinic. So hibernating myocardium, I'm just gonna sort of show this here. This is an example of a PET scan, which is a way to image the heart muscle directly. And there's a way to check the blood supply to the heart, which is what this is doing here. It's called N13 ammonia perfusion imaging. And you can see, you know, when the heart's actually dead or scarred, or form scar tissue, if you image it, there's no blood flow going. And if you look at it with what's called FDG or glucose metabolism, you can see there's no circulation. I'm sorry, the heart is actually not alive here. Whereas with hibernating myocardium, you actually have a situation where there's not enough blood flow. There's really poor blood flow to that portion of the heart. But if you look at it another way, it's actually alive. So this was actually the first way to really prove the theory of Dr. Rahimtullah in a real way, that it's for real. And this is actually what his genius was that he discovered, he theorized that something exists, and it was later proven by medical technology, and it was immensely life-saving. Half of all patients with heart disease have this condition where the heart is not dead. It stops beating normally, but it's not dead. And when you restore the blood supply, it starts beating normally, and this can really give a new lease on life to a patient. And then prosthesis-patient mismatch, that's a situation, of course, where there's not enough, the valve is typically not the right size, it's too small for the patient. And if you can recognize this ahead of time, you can know that this is what size valve the patient really needs. It's really an important finding to be able to recognize and hopefully fix if the patient needs it to be fixed. And the example here is a wrench and a bolt. You know, the wrench is really what the patient needs, the large size, and the bolt may be the replacement heart valve, which is just too small for the patient. So this is really two major concepts in modern cardiology that Dr. Rahimtullah basically discovered and pioneered, and is recognized for his great work. Next topic is the first implantable artificial heart. This is actually an engineering breakthrough. This engineer actually invented this artificial heart that weighed less than a pound with no outside attachments. His name is Dr. Tawfiq Musaband. He's a biomedical engineer. He's actually known as the heart saver. He went from being a goat herder to, as a child, to the inventor of the artificial cardiac pump. Really had some very humble beginnings. In fact, he amazed the medical world by developing this within a 4-year time span. He actually is responsible for many other biotechnology breakthroughs. For this, he was awarded the Queen Elizabeth II Diamond Jubilee Medal in 2013, and many other awards. There was actually recently a podcast about Canadian history, and they picked out 100 events in Canadian history. And this was actually one of the events that was featured, was his invention of the artificial heart that could be implanted completely inside a person. Dr. Tawfiq Musaband. Okay, so let's move on to a slightly different topic, heart failure. Heart failure, as we mentioned, can be due to valves inside the heart not working properly. That's one of the causes of heart failure, where the heart just is not able to do its job properly because the blood may be traveling backwards, or it can be a major problem. in one type of situation is called, a problem with the mitral valve, which is a type of valve in the left side of the heart. Between, there's 4 chambers in the heart, and this valve is called the mitral valve. And this doctor actually, typically, if there's a problem with this valve, it would require surgery to have it fixed. Well, this doctor actually figured out a way to fix this mitral valve without surgery through a small catheter. I want to introduce Dr. Mehmet Oz. I think people may be familiar with him for other reasons due to his talk show. He's a cardiovascular surgeon, but, of course, a prominent TV personality. But what I think medicine really recognizes him for is his groundbreaking catheter-based device for patients with heart failure. He developed what's called the MitraClip. It actually stitches the valve from the inside through a small catheter to narrow it so that the heart can function properly and it can prevent or fix heart failure, the cause of heart failure inside a patient. Very remarkable invention. And this is something that Dr. Oz actually patented. And even today, I was actually reading an article about there was for heart transplant patients, this device can actually allow patients who couldn't receive the heart transplant to be candidates for it, about 15% of patients. And then it also allows 25% of patients who would have really needed an artificial heart, I should say a heart transplant, to no longer need it, about 25%. That's a pretty remarkable number based on a study that was done in Europe. Just today, I read this article about the MitraClip. I want to talk also about Dr. Kadri. He's also a cardiovascular surgeon. And what he did is also pretty remarkable. He actually invented a catheter-based way to completely replace the mitral valve, not just to stitch it in place without surgery, but also actually to completely put in a new mitral valve. Again, without surgery. It does not require opening up someone's chest to put in a valve surgically to replace the patient's normal valve. He actually invented a way through a catheter to do this. And this is a very impressive achievement. The technique actually involves putting in a catheter inside the veins, going into the right side of the heart, and then creating a small hole to connect into the left side of the heart using this catheter, and then putting the valve and having it self-expand. The device is actually a self-expanding type of valve, and then having it open right at the spot where the mitral valve needs to be and replace the person's mitral valve. This has already been shown to work in numerous patients, and his company was called Cardiac AQ, was actually acquired by Edwards Lifesciences for $400 million in 2015. So it's a very impressive achievement. How about blood pressure? Many people are probably familiar with high blood pressure. Perhaps many of us even have been diagnosed with it. We take it for granted. It's fundamental to all clinical practices. Anytime you go to a doctor's office, you'll certainly be having your blood pressure checked with a blood pressure cuff. You can even get it done in grocery stores. It's basically one of the basic vital signs that we do in any type of assessment of any type of patient. Well, I want to introduce Dr. Frederick Akbar Muhammad. He was actually a physician in England in the late 1800s, and he actually described the basis for what we know as essential hypertension, basically what we would call high blood pressure. He fundamentally changed how we understand high blood pressure, and in fact, as a medical student, developed one of the precursors to the blood pressure cuff. He contributed to a number of other advances in medical care, including blood transfusions, when you need to have blood from an outside source. Let's say you don't have enough blood and you need to have blood replaced. He actually pioneered a lot of the work involved in that. He also worked on some of the surgical technique on appendectomy, which is removal of the appendix. If someone has an inflamed appendix, it has to be surgically removed. He actually wrote some important work in that technique as well. And furthermore, he initiated what's called the Collective Investigation Record, which is a precursor of modern collaborative clinical trials, which is how medical knowledge advances, is through clinical trials, and he developed actually the precursor to that. The next doctor I'm going to be talking about is, he actually also worked in heart disease. And cardiovascular diseases, of course, are the leading cause of death throughout the world. One of the major things that he worked on is a class of drugs called ACE inhibitors. This is actually one of the fundamental and most widely used drugs for the treatment of high blood pressure and heart failure. And it inhibits it inhibits what is called a hormonal system that would be harmful if kept unchecked by this drug. And it helps dilate the blood vessels and reduces the workload that the heart needs to do. And he is actually able to show that use of this drug resulted in 10% reduction in cause of death, all causes of death, and also 12% reduction in death due to heart disease. And he also did similar work on another class of drugs called beta blockers, which also showed that it was helpful for the health of the heart in people who need it due to heart disease. So let me introduce Dr. Salim Yusuf. He's a cardiologist and epidemiologist. He actually, in fact, is the second most cited researcher in the world for 2011. And actually even in this day and age as well, he's been cited over 320,000 times. He actually, one of his most profound contributions to medicine is his groundbreaking epidemiological studies, not only the studies themselves, but actually the methodology of conducting large-scale international clinical trials. This is actually his gift to humanity. This is the basis for many advances in epidemiology and understanding cardiovascular disease. He really did a lot of fundamental contributions in terms of the benefits of using aspirin, clot-busting drugs in heart attacks, identifying risk factors for 90% of strokes and heart attacks, so that you can actually prevent strokes and heart attacks in someone if you know what the risk factors are. Hopefully you can modify or reduce these risk factors, and this is really the way to prevent this deadly disease, heart attacks and strokes from occurring. He was able to also, his current goal is to reduce the burden of heart diseases globally by 50% within a generation. Dr. Salim Yusuf. How about the fourth leading cause of death, which is actually blood clots that break off inside the veins and go. So what happens actually is that if you are not moving very much, let's say someone is disabled or has had an injury in their legs, they're not very active, or if they have cancer, for instance, and that causes the clots to form because their blood is, has a higher tendency to clot. Clots can form inside what are called the deep veins inside the legs, and they can actually break off. And what happens when they break off is these pieces actually travel through the heart, and they can actually go and lodge inside the lung arteries. And that's where the damage occurs, because once that happens, the heart can't actually pump blood through the lungs, and that results in no oxygen getting into the blood, and that can actually cause death. And so this is a major problem. Over 900,000 people a year are at risk in the United States alone for this condition. It's called pulmonary embolism. It's due to deep vein thrombosis or clot inside the deep veins. Let me introduce Dr. Qazi Mobeinuddin, who's a cardiovascular surgeon. He recently, he passed away a couple decades ago, but he's actually known as the father of endovascular surgery. He was the inventor of what's called the inferior vena cava filter, also nicknamed the umbrella of life. This was actually the only device available for the prevention of pulmonary embolism in the 1970s throughout the world. Even today, there's a version of his device that's still being placed. This was his original device, by the way. It was called the umbrella, the filter, inferior vena cava filter that he invented. It actually self-expands, so it's placed through a catheter. A small catheter does not require major surgery. And over 50,000 of the modern version of his device are placed in the United States every year. And what his invention did was it was actually a catalyst for the development of the burgeoning field of minimally invasive endovascular surgery, meaning catheters to do what used to require surgery. He did numerous other areas of research, which are very, very important. In fact, even in retirement, he was busy in his research endeavors. Dr. Qazi Mobeinuddin. Let's talk about blockages in the arteries. You know, in the lower extremities, for instance, when you have a blockage in your leg artery, you get what's called critical limb ischemia, which means that there's not enough blood flow for the leg or foot to survive. And often this, if this is not fixed, it can require amputation, as 185,000 of these occur per year. Really the way to solve this problem in a patient was to do what's called a bypass. It's a type of surgery where it's a long incision and you basically connect the artery above the blockage to the artery below the blockage. That's called a bypass. And that's basically an involved surgery. And a lot of times, this was really the only way that you could save someone's lower extremity. Well, let me introduce Dr. Aman Bolia. He's an interventional radiologist. He is actually a pioneer in interventional radiology. He invented what's called the Bolia technique. It's also known as subintimal angioplasty. It was a technique to open blocked arteries that previously required major surgery or if that didn't work, amputation. He actually invented this way to do this using a simple catheter and guide wire. And basically you can push this wire and catheter through the blood vessel wall around the blockage, around that hard blockage, and have the wire and catheter break into the normal blood vessel below the blockage, and you can create a connection between above the blockage and below the blockage without surgery. It did the equivalent of surgery without surgery. And this was actually a major medical breakthrough. In fact, people just really didn't believe that this happened, that his technique actually worked. He presented this at numerous meetings and really was not taken very seriously. And he told me his frustration when this was happening. But his technique was so revolutionary that it is now the standard way of how blockages are opened up. This is really a technique that surgeons now are doing, as well as interventional radiologists and cardiologists. He actually got the Hospital Doctor of the Year award for the United Kingdom in 1995. He told me in his hospital, there's 4 vascular surgeons, and they only do a handful of surgeries a year as a result of his technique. They used to do hundreds of these surgeries a year at this huge hospital that he worked at in Leicester, United Kingdom, and for these vascular bypass surgeries, as a result of his technique, it's only a handful that are being done afterwards. Let's talk more about preventing amputations. The whole subject of amputations, amputations occur in the lower extremity typically due to inadequate blood flow. This is a condition known as peripheral arterial disease, PAD. It's a complication often seen in diabetics. 2 million Americans have had amputations. 185 amputations occur every year in the United States. Well, let me introduce Dr. Jihad Mustafa. He's an interventional cardiologist. His nickname is actually the Leg Saver. He fled war-torn Lebanon in the 1980s when he was 15. He arrived in New York City not knowing any English. His first job was selling umbrellas. And later on, he moved on to working in a big boy restaurant where he was cleaning toilets. Very humble beginnings, but he eventually made it to medical school and cardiology training and developed a practice where he became the world's leading expert and innovator on the treatment of critical limb ischemia to prevent amputations. His technique is quite revolutionary. he actually pioneered what's called transpedal arterial minimally invasive technique, where if there's a blockage and someone's going to need an amputation, you can actually put an IV straight into the artery inside the foot and open up the blockage above that using a catheter and IV in almost like a reverse way of doing it. Instead of doing it from above, you would actually do it from below, right from the foot itself. And his technique is now also a standard practice that is used in these types of procedures to save lower extremities, and is also now being done by interventional radiologists, cardiologists, and also surgeons. He holds one of the world's largest meetings on amputation prevention. It's called AMP. In 2018, there were over 850 healthcare specialists attending. Similar numbers in 2019. In 2020, of course, it was a virtual meeting because of COVID, but similar numbers as well. Dr. Jihad Mustafa. How about traumatic brain injuries? Everyone's probably familiar with this. Football players, this has come into the news lately because football players often endure this. Even another common reason to have traumatic brain injury is in a car accident. This is a very devastating injury. And this doctor was the first to study and characterize this. He also developed an innovative way to prevent painful lumbar punctures if someone needed chemotherapy for a brain tumor or other tumor of the nerves. Dr. Ayub Omaya, who is actually a neurosurgeon. So Dr. Ayub Omaya, he actually established seminal research on the biomechanics of traumatic brain injuries. He actually also was the first to classify a condition called CSF rhinorrhea, or leakage of spinal fluid from the nose. This can also occur due to injury. And he inspired the creation of the Center for Disease Control's National Center for Injury Prevention and Control. So this is really, his work was the foundation of trauma prevention or injury prevention. And he also invented what I talked about to avoid lumbar punctures, which are very painful, to deliver chemotherapy to brain tumors without needing that. Basically, he invented a reservoir that you can implant below the skin that's connected directly into the brain through a small catheter. And all you need to do is puncture the skin through a small needle, and you can deliver the chemotherapy safely right into the brain where it needs the chemotherapy to kill the tumor. So this was a pretty revolutionary invention. The other thing that he amazingly did is something completely unrelated, but he actually pioneered the concept of islet cell transplantation to treat the cause of type 1 or childhood diabetes. This is actually now a cutting edge treatment at the forefront of research. Okay, next is neurodegenerative diseases. Everyone may have heard of a condition called ALS, or muscular dystrophy, or dementia. Well, this doctor actually is one of the pioneers in developing the genetic, or understanding the genetic basis of these diseases. I want to introduce Dr. Tipu Siddique, who is a neurologist. He actually pioneered the first molecular genetic approach to ALS. He had identified the first genetic cause of ALS by studying the genes, or the genetics. He was a major figure also in developing the genetic cause of muscular dystrophy, dementia, and neuropathy. In fact, he even figured out a way to make normal skin cells into brain cells using stem cells. For this great work, he was actually nominated for a Nobel Prize in Medicine. Dr. Tipu Siddique. Talking more along the lines of genes and genetics, this doctor actually discovered how the DNA is what makes up our genes, or our heredity. It's actually the chemical substance inside our cells that is responsible for our passing down our traits to our children. He actually figured out that DNA, this molecule, also known as deoxyribonucleic acid, actually can fix itself or repair itself. And this mechanism he discovered, it's very important in the process of aging and cancer. He also discovered what the basis for the biological clock. There's actually an internal clock inside our bodies called the circadian clock. It's responsible for us waking up every morning at the same time. It's responsible for, jet lag, why we experience jet lag when we travel by plane. So this doctor is Dr. Aziz Sankar, who is a biochemist, also an MD. He actually got the Nobel Prize in Chemistry for his work in 2015 for discovering the DNA repair enzyme. It's called photolyase. This actually has huge importance in cancer and aging, understanding these conditions and perhaps treating them. He also identified 2 genes that are key in regulating the circadian rhythm inside cells. So Dr. Aziz Sankar was awarded the Nobel Prize in Chemistry for this. And this is, of course, one of the highest achievements in the world that you can get in a particular field, the Nobel Prize. Let's talk about radiation therapy. Cancer is one of the most terrifying diagnoses. Every year, 1.7 million to 18 million Americans around the world, 1.7 million Americans to 18 million people around the world are diagnosed with cancer. The most common types are lung, breast, skin, prostate, and so forth. Well, this doctor, I want to introduce him, Dr. Alam Nisar Syed, who's a radiation oncologist. He actually single-handedly revolutionized cancer treatment by developing interstitial brachytherapy. He actually invented a way to avoid not only chemotherapy and radiation therapy, where you're bombarded with high radiation doses and even surgery. You can avoid surgery, chemotherapy, and radiation therapy by his technique, which is a minimally invasive way to place cancer-killing radiation right inside the tumor itself. You do this through small needles. He invented what's called a Syed template, which is a form of grid to actually allow you to implant these, what are called seed implants, right into the tumor. And it's a very safe and revolutionary way to treat cancer, which is minimally invasive at the same time. His technique is actually used now to treat prostate, cervical cancer, breast cancer, head and neck cancer, skin cancer, gallbladder cancer, uterus, vagina, all sorts of cancers. It's really pretty amazing. He's trained over 200 other physicians with his life-saving procedures around the world to perform this critical treatment. Dr. Alam Nisar Syed. Let's talk about myelodysplastic syndrome. This is a condition that most people aren't probably aware of if you're not a physician. It affects 60,000 to 170,000 Americans. It's characterized by a group of symptoms such as anemia, fatigue, discoloration. It's caused by, it results in some abnormal blood clots that can form. It's called myelodysplastic syndrome. It's really a problem inside the bone marrow, which forms the blood cells. I want to introduce Dr. Azra Raza, who's a hematologist oncologist. She actually discovered the cellular genetic causes for the treatment, as well as the treatment of she basically did pioneering work on the cellular and genetic causes and treatment of myelodysplastic syndrome and myeloid leukemia. She established the MDS program to study myelodysplastic syndrome and created what's called a repository to help 60,000 samples to study this disease in depth. Not only myelodysplastic syndrome, but a similar condition called myeloid leukemia. President Obama actually selected her for his Cancer Moonshot initiative to lead it in 2016 because of her expertise in cancer. Let's talk about a disease that is so miserable that it not only causes blindness, but it causes severe itching to the point of self-mutilation. It can result in the inability to sleep or concentrate. It's so bad that it can even drive its victim to suicide. This disease, this terrible disease, plagued Africa and parts of Latin America for most of the 20th century. It affected countless hundreds of millions of people. It was actually spread by this fly, this black fly. It's a parasite, and there's a parasite that it carries that when it bites you, it injects this parasite into your bloodstream. And it affected many parts of Africa and Latin America. Let me introduce Dr. Mohammed A. Aziz, who's a parasitologist. He actually provided the first clinical experience for a revolutionary drug called ivermectin. It was actually the first and most effective cure for African river blindness, which is what I talked about. It's he treated over 1 billion, over 1 billion cases have been treated. 100 million people a year are treated every year to prevent this disease. He is actually responsible for eradicating the disease in many parts of Africa and Latin America. He was instrumental in the effort to make this drug free to communities that could not afford it. Had he not passed away early in his career, he almost certainly would have received the Nobel Prize in medicine for his outstanding accomplishment. Now, that seems like maybe an exaggeration. I mean, why do I say that? Well, I can say that with certainty because his junior colleague, Dr. William C. Campbell, was awarded the Nobel Prize in Medicine in 2014 in his place. And recognition was given to Dr. Mohammed Aziz during the Nobel Prize ceremony. So, Dr. Mohammed Aziz, let's talk about glaucoma. Glaucoma is one of the leading causes of blindness in people over the age of 60. It's due to excess pressure inside the eyeball. It's normal, normally the eye looks like, like this. If there's excess pressure inside the eye, you can develop glaucoma. And I want to introduce Dr. Abdul Mateen Ahmed, who's actually a biomedical engineer who made a major contribution to the field of ophthalmology, or the study and treatment of eye diseases. He actually was the inventor of the glaucoma valve. He formed his own company. It's called New World Medical. It actually has captured 70% of the world market for glaucoma valves. He actually was inspired to create this invention when he was seeing patients who were developing glaucoma as a result of that disease that I mentioned, African river blindness. He figured out a way to reduce the pressure inside the valve, inside the eyeball, by creating a special device that can take out fluid and has a valve inside it to make sure that the fluid comes out in one direction to reduce the pressure inside the eyeball as needed, with the perfect amount to keep the eyeball properly pressurized, but not too much. And so his device is called the Ahmed glaucoma valve, and it has captured 70% of the world market for glaucoma valves. How about the National Institutes of Health? This is one of the major medical research institutes in the world. There's 27 institutions. It's actually located in Bethesda, Maryland. It's the United States government's research institution for medicine and biomedical research. It actually is right behind, it has a budget of $30 billion. It's ranked #2 in the world for its quality and volume of research in the biomedical sciences, right behind Harvard University. Let me introduce Dr. Elias Zerhouni, who's a radiologist who is actually appointed the NIH director from 2002 through 2008 by President George W. Bush. He was actually also a consultant to the Reagan White House in 1985. He was the first presidential US science envoy to President Obama in November 2009. He pioneered many techniques in radiological imaging. For instance, MRI technology for cardiovascular disease and cancer detection, for the non-invasive method for 3D tracking of heart motion, and also for CT imaging for early breast cancer detection. Dr. Elias Zerhouni. Let's talk now about something that's probably very, very much everyone is very familiar with, as it's in the news every day, the COVID-19 pandemic and the COVID-19 vaccine. Let me introduce Dr. Saira Madad, who's an epidemiologist. She is actually internationally recognized as an expert in public health and infectious diseases. She helped treat and document the first case of Ebola in the United States. As of 2020, she is currently the Senior Director of the Special Pathogens Program at New York City Health and is considered one of the United States' largest municipal healthcare delivery systems. She was actually featured in the Netflix series Pandemic: How to Prevent an Outbreak, concerning control measures and the science behind the spread of special and highly contagious diseases. Here she is actually being featured on CNN. She's being interviewed where she's talking about the risk of spread of COVID. And this was just this past summer, Dr. Saira Madad. I want to introduce also another doctor, Dr. Mansef Saloui, who's a molecular immunologist. The actual COVID-19 vaccine, it's the project dedicated to finding this vaccine is actually called Operation Warp Speed. This is the United States vaccine development effort for COVID-19. He's actually the head of this program. In fact, the Secretary of Health and Human Services, Alex Azar, in picking him, he said that he described him as arguably the world's most experienced and successful vaccine developer. He's done many other impactful vaccines, such as the first ever malaria vaccine called Mosquitrex, the first cervical cancer, the vaccine to prevent cervical cancer, the first vaccine for Ebola, a vaccine to prevent diarrhea in children, and also for pneumonia. He's actually listed as one of the world's 50 greatest leaders by Fortune magazine in 2016. He was actually chairman of a pharmaceutical company called GlaxoSmithKline. He was the R&D director. It's only fitting, I think, that a Muslim is one of the world's leaders in developing this vaccine, as the world has actually come full circle in that Muslims in the Islamic Golden Age actually pioneered the concept of acquired immunity. This was actually first described by Dr. Ar-Razi in the 8th century. And inoculation was actually a routinely practiced effective precursor to vaccination for smallpox. In fact, the technique of inoculation was introduced by European physicians and scientists based on it was introduced to Europe based on their observations of this routine practice in the Ottoman Empire and throughout the Muslim world. In other words, this technique was practiced for hundreds of years in the Muslim world before it was introduced to Europe. Of course, nowadays we know of the smallpox vaccine, the inventor is Edward Jenner, but really the basis for this was the inoculation technique that was prevalent throughout the Muslim world. So in conclusion, I can say that Muslim innovation and contributions to modern medicine is alive and kicking. It's important to have an awareness of these physicians and their great contributions. I think that really this is a huge source of inspiration and pride for all of us. They're really amazing role models. In fact, this is only a small sampling of the many Muslim physicians who have made profound contributions to modern medicine. Unfortunately, many of these physicians did not want to be included. We've actually written a chapter that has even greater list of these physicians. I think that greater recognition should be given from a lot of Muslim societies to help counter Islamophobia and instill a more positive view of Islam and Muslims. So in a way, I think that the golden age of Islamic medicine has never left. It's still here. I think that we can really be proud of all of these amazing doctors and scientists and inventors. Thank you for everyone's attention. Any questions?
Jazakumullah khair, Dr. Mubin Sayed. Amazing, amazing presentation. This is why I'm like so just like astonished of what NIMS presents constantly. And it's just sad how like speaking on behalf of the youth, Muslim youth, how we really don't have pride in, saying we're Muslim or, showcasing amazing contributions we really have on the world at large. Do we have any questions?
Mubin, I must congratulate you on your excellent presentation. I think this is an eye-opener for our young generation who should aspire for excellence in all fields of science and medicine. So this is your research and this into this field of the current contributors to the science of medicine is really remarkable, and I congratulate you again. And I want to point out that you have written a chapter in our forthcoming book, Contributions of the Islamic Civilization to the Development of Medicine and Science, which will be coming, inshallah, published in 2021. We want every, people who are interested in the subject to look for the book and your chapter as well. My question to you is, why have the Muslim, you said there are 2 billion Muslims in the world. How come they're all sleeping and they don't even know what their own community is contributing to the development of sciences?
And that's a great question. I mean, that's really, it's unfortunate. I think it's really our role to, first of all, find these, to, become aware of these physicians before we can actually promote them or recognize them in our Muslim societies. I think that's really the key thing here, is that many people are not, overtly known as Muslims, and so we don't really know who they are. But if you, I think that's really basically the main reason. I think there's plenty of doctors who've made some really amazing contributions. I think it just needs to be publicized what these physicians have done.
In fact, perhaps, I might encourage that you've already written a chapter. Maybe you should write a book.
That's a great idea, yes.
There are some other people that have joined. I see that Dr. Qadan is one of our board of directors, is on the panel here. Dr. Qadan, you have any questions for Dr. Mobeen? I don't know if you can hear me, but probably
You
not.
hear me now?
Yes, we can hear you now.
Okay. So first of all, I would like to express my thanks. This very, very, very wonderful lecture. So I highly appreciate the effort of Dr. Sayed for doing such kind of lecture. So I just would like to comment that when I was in Syria, I thought and began to work on before the war in Syria in a project which is, I called it PAP Encyclopedia, Prominent Arab Physician Encyclopedia, and together all contemporary physicians in the Arab world, and to be recorded in such a kind of golden book or something like that. Now, I wonder if Nagamia Institute, for example, could begin a project on, instead of PAB, it will be PSPAB, Prominent, Muslim Physician Encyclopedia. So I think this lecture now, it could be the core of this project. And then step by step, we can add many, many of scholars actually to be registered in this book. And we have to put a kind of conditions. It is not just any doctor, for example, to work all over the world, for example, and just he was very brilliant in his work or something like that. He should have a kind of achievement, and we have to put a criteria why we, for example, to mention in this book. So I wonder if book could be developed, or this encyclopedia by Nagamia Institute, and to put, for example, a criteria for such editing such book. I think it will be very, very important achievement of Nagamia Institute in this regard. Thank you.
Thank you very much. That's a very, very, very valid suggestion. Dr. Qadan, I think definitely the board of directors of NIMS can look into it and act on it. I mean, that's what our purpose is. The purpose of NIMS is to promote the achievements of the Muslims in all sciences, including medicine. And I think we could definitely sit down, have a subcommittee that can look into the criteria that we need to develop for people to be recognized and be included in this kind of monograph. So that's a very valid suggestion. Inshallah, we'll take it up.
Inshallah.
Are there any other questions from either attendees or panelists? If not, I think I again congratulate Mobeen for doing such a tremendous job, collecting all these names and working on their achievements and going into the depth of their research. We thank you very much, Mobeen, for all that achievement.
Oh, my pleasure. Thank you. Thank you
And,
for the opportunity.
Inshallah, will continue. As we said that, you have lit a little spark and hopefully it will grow into a flame. Thank you very much.
Thank you.
I think we can conclude. Anybody else has any questions? Any more questions on the board? Alia, do we have any questions?
No, we're fine.
Thank you. So we'll all leave. Thank you very much.
Thanks.
Yeah.